Hello everyone, I'm Dr. Jibraan, consultant neurosurgeon at Mythri Hospital. Today we're going to talk about how stress affects multiple systems in your body, but more specifically how it affects your spine and why in the recent days we've been seeing a spike in the number of cases related to spine ailments. So firstly, whenever you're stressed, there is a primitive response that your body is used to, which is called a fight or a flight response. So whenever something like this happens, when you get stressed, your muscles tense up, and there is release of a lot of hormones in the body, which are called stress hormones. The most prominent of this is cortisol. So as the cortisol spikes, there is inflammation, there is tightening of your muscles. At the same time, the ligaments around your spine that are supporting your spine, that help you in all of the movements that you do with your neck and your back, they become softer. Over time, if you're constantly stressed, this spasm of the muscles leads to pain. In the initial stages, the pain only comes from this spasm, but if you're constantly and consistently stressed, which I think none of us are immune to in the life and the rat race that we live through, this leads to some permanent changes in your spine. Eventually, your spine does not remain as stable as it used to. So your movements are restricted, and if you do try to do those movements, then you are opening yourself up to something called spine instability and disc disease. When you are stressed, your brain is also on constantly wired up. You're on high alert. So every little stimulus, every little piece of pain that you feel, a bit of pain that you feel, gets amplified. It's called psychosomatic amplification, where your brain senses the pain to a much higher degree than it actually is. The next thing, the common ground that a lot of people share in their workplace today, is the use of a computer. Most often the desk jobs involve looking at a screen for hours together, especially in the IT sector, and not just the IT sector, everybody else these days. This is something called a tech neck. You put your spine in a restricted position constantly for hours together, and your brain has not registered that you've been doing this because it is so engrossed or focused at your work. So this is called the tech neck, and it compounds your problems further. Your neck and your spine, your lumbar spine and your dorsal spine, all were built to support movement and to keep moving, to keep you fluid. Once you take away all of these factors, all of them culminate together into something called spinal degenerative disc disease. So this spinal degenerative disc disease is the leading cause of young people having to get surgical interventions done on their spine. How you can manage this, we'll get to it in some time. But adding to all of this, when you are constantly stressed, and we live a lifestyle, especially in the urban population, where you are constantly sleep deprived. Your sleep is not complete, or it is disturbed. If you do sleep 8 hours, you sleep a very disturbed sleep, because in the background you're still stressed about whether it is work, your personal life, any other issues. The current generation has been exposed to a lot more of stress inducing factors than I believe the older generation was, but I'm sure they would disagree with what I have to say. So the constant stress, the lack of sleep, then add to that the sedentary lifestyle. The sedentary lifestyle of the urban youth is a curse that keeps on giving. So for instance, aside from all of the recent young age heart attacks and all of the other issues, strokes that you're seeing, the one thing that it is adding up to is a whole population with unhealthy spines. Now, some of these people do take care of their own self. Some of our counterparts, let's say, they take care of their bodies, they go regularly to the gym, they work out. But even in that population, if it is not done right, if you're not working on your core is essentially your spinal muscles, your abdominal muscles, the muscles in your chest. If you're not working on your core, then you are opening yourself to even more problems. The classical case that I will tell you is somebody who goes to the gym and competitively they're doing deadlifts without proper training, without proper precautions. You just keep scaling up the weights and you lift it up, suddenly the entire disc from one of the spinal levels, or multiple levels in some cases, just pops out of the vertebral space. It goes into the spinal cord. I've seen young patients who have come to me without any power in their legs because of gym related injuries. So there is a need for a reform in the way that we look at our health. There is a need for a form of revolution that needs to come in, that tells you that health over your job, health over your personal issues, and health over everything has to be the norm. You have to take care of this. How you're going to do this, how you're going to break out of this vicious cycle, depends all on yourself. You can try meditation. There are multiple exercises, yoga, structured exercises rather than just exercises. Indulge yourself into sports. I personally believe in a little bit of athletics, a little bit of individual sports. Give yourself time, give your body time, treat it like it deserves to be treated, and it will keep you pain free and healthy for the next 20, 30, 40 years to come. But what you do now in your young age matters in the future. The number of hospitalizations, and I'm not just talking about spine right now, every other system is also affected by this. I am focusing on the spine because those are the highest number of patients that I see every day. The bike riding, the amount of traveling that people do without proper precautions, without any preparations, all of this eventually is culminating into an entire generation, an entire population. 8 out of 10 people who are developing these problems. In fact, in my own home, I know my own brother, despite having somebody to constantly advise regarding this, he's very careless, and he did recently have to get some investigations done for the same issue. So nobody is immune to it. The only thing that you can do is actively work on preventing these issues, actively work on your stress, actively work on your core strength, actively work on meditation, actively work on a holistic approach to your own health. That's all I have to add. And if you do eventually develop, despite taking all of the precautions, you do develop some issues in your spine, we're always here to help you out.